The Bob Marley tune. I'm glad they finally negotiated for your release, though. Sometimes it takes the FBI hostage crisis team to do it. The last speaker today is someone I've known for a long time. It takes a brave person to sign up to have an operation with somebody only a couple years out of training, but that's exactly what Ralph Cheney did. I've known Ralph now, it's a decade, and he's going to come up and tell his story. I hope he'll also talk about all the work he's done with PanCan and the Pancreatic Cancer Research Act and all of that. So Ralph and his wife Marianne have been perennial supporters of advocacy for pancreatic cancer, and they're a real inspiration to me, and they should be to everybody else in this room. Ralph, please come up.
Thank you, John. Well, my name is Ralph Cheney. My wife Marianne and I, and our therapy dog, Ace Cheney Super Dog. Yes, that's you, Ace. We decided to bring Ace today because we feel that dogs can provide a lot of love, care, compassion, and what somebody might need in along the way of the therapy and treatment. And I had 4 of them, so I must really be well psychologically, I guess. So we're from Monticello, New York, and believe it or not, I am a 10-year survivor of pancreatic cancer. First of all, I would like to thank Dr. Allendorf for asking me to be here today with all of you to say a few words. This is going to be more than a few words, so get ready. I consider it an honor to participate in any event to further pancreatic cancer awareness, and I am sure most of you will agree, like John and Dr. Z were saying, that the landscape has changed as far as the treatment and protocol for pancreatic cancer since I was diagnosed back in January 2005, and it's also changed in the areas of research, patient care, community outreach, advocacy, and donor and corporate relations. And this is all a good thing. As I look back, I was very fortunate to have the events play out as they did, believe it or not. When I first saw medical treatment for abdominal and back pain, which was actually pancreatitis in July of 2004, I was misdiagnosed with diverticulitis. A CT scan and sonogram of my abdomen revealed gallstones and a shadow on my pancreas. It was suggested that I have my gallbladder out, which I did, and I soon find myself back in the hospital in November 2004 with pancreatitis again. Okay, so now I have chronic pancreatitis, and the answer to my wife's question if this could be a tumor was laughter from the gastroenterologist treating me. And he said the pancreatitis did not indicate a malignancy and suggested that I wait 6 months and scan again. Well, we all know that the adenocarcinoma of the pancreas is a very aggressive cancer, so waiting 6 months was probably not such a swell idea. My wife said no way we were waiting, so that was the result of that. With me still in the hospital, instead of sitting at the table to a family Thanksgiving dinner, Marianne was on the internet looking elsewhere to try to get me somewhere where we could get better answers and definitely a better bedside manner. She found the late Dr. Pete Stevens, who, as it turns out, was not only a great doctor, but became a close friend. He performed an EUS, like was described before, but could not get a good biopsy because the tumor was in the middle to the tail of my pancreas, which was up on the board before. And he told us that he visualized a suspicious section of the duct of my pancreas, possibly a tumor, and suggested that I see a surgeon, his colleague, Dr. Allendorf. Dr. Allendorf concurred with Dr. Stevens and the surgery was set up. So here I was with no diagnosis, looking forward to a major surgery that I was probably not eligible for, but because of the experience and vision of 2 great men in their field, I got an operation that most people don't get because of the doctor's experience and expertise. I did get the surgery. As I was doing the pre-op testing upstate, the local medical doctors were harshly critical and counseled me not to have the surgery because there was nothing to indicate I had cancer, and the surgery was quite invasive, which I didn't know that. And it's probably a good thing. Dr. Allendorf performed a distal pancreatectomy and splenectomy, and a week later the results were in. Stage 3A ductal adenocarcinoma, poorly differentiated, wrapped around the splenic vein. And I'm taking all this on faith because Dr. Allendorf was in places in my body that I haven't been before, so when he said that that's what it was, well, I guess that's what it was. Fortunately, no new lymph nodes were involved from what was biopsy, which provided better prognosis. The same day of diagnosis, I had a series of 3 cerebral hemorrhages and landed back in the hospital, where Dr. Allendorf waited for us to make the trip down into New York City. It was late in the evening, and he waited for us. We had a CT to make sure that the pancreas was okay, and it was. And then we had our first experience in Washington Heights in the ER on a Saturday night, which is a night that we will never forget. However, the stroke left no lasting outward physical effects. However, I have a very bad term, short memory still today as a result of the stroke. And I apologize for having to read this just for that reason. At some point in time, if I wasn't reading this and just doing bullet points, I would stop and just totally lose my train of thought. So I apologize for the read. The next step in our journey was setting up a post-surgical treatment plan. As I said before, treatment options as soon as 10 years ago were not as plentiful as they are today, and consisted basically of 5-FU, which is still up there, and Gemzar as first-course chemotherapies with radiation and maybe not radiation, depending on how, what was going on out there in the cancer world at the time, what the Europeans were saying, what the Chinese were saying, what this guy was saying, what that guy was saying. So I was due to start an aggressive path of chemo under my oncologist in the city. The theory was aggressive cancer, aggressive treatment, which kind of made sense. Actually made a lot of sense. And I believe that the protocol at that time was going to be GTX. However, due to the devastating death of Jim, our brother-in-law, my best friend and best man, I was not emotionally or spiritually ready to start the regimen as we buried Jim before the day I was supposed to take my first dose of Xeloda pills. I needed to be entirely ready to do this. That's when we decided that Gemzar was the best treatment, and that with 39 radiation sessions in between was what the team decided was best. No chemo port for me. I don't want another surgery. Well, let me tell you something, folks. Going through all of the 6 months of chemotherapy, finding a vein every time was probably not such a good idea. So, for those of you who are trying to figure out if you need a port or not, my suggestion is that you do get a port for your chemotherapy as well as the bloodletting that they do from time to time, every week, I guess, if you're gonna get through chemotherapy. So, finding doctors upstate also to administer the protocol was a challenge, to say the least. We heard everything in our local medical community from, well, you have 3 to 6 months to live, so why bother? The recurrence rate for pancreatic cancer is 80%. You probably should go and get your affairs in order, because this is liable to return and be your demise. And I'm sure you had a wonderful surgery, but where I come from, we don't describe to that protocol, and you have about 3 months of quality of life left, which was, I got 90 days. I got 90 days to survive. We finally found a wonderful oncologist through a pancreatic cancer patient that was willing to be, the doctor was willing to be my primary doctor, as well as follow the protocol from the doctors in New York City. And bonus time, the radiation oncologist was in the same building. It does not get any better than that. Both doctors willingly collaborated with my care, which was a good thing. I'd just like to say at this time that I was just becoming aware of the severity of the disease of pancreatic cancer. I guess ignorance is bliss, and that's kind of like where I was at to a point, to keep focused. And I made up my mind that I would do the treatment in memory and honor of Jim, who had passed away, and Janice, Mary Ann's sister, who passed away from lung cancer in 1997 when she was just 50 years old. And I was also going to do that for all those PC patients who had come before me too. I was not going out without a fight. My attitude was, when they told me I had 3 to 6 months, it was like, oh, please, come on, this is not going to happen. The fact of the matter is that I did not know the statistics. I did not know that this could have been an accurate assessment of how long I had. Fortunately, it was not, and I did put up a good fight. Mary Ann, Dr. Allendorf, and Stevens, and the team that met Thursday mornings will always have my eternal gratitude, and eventually that also continues here at Winthrop, and I am certainly grateful for that. I'm also a firm believer that any university can have a good outcome come from it, and had no idea that we would get involved in the chase to find a cure to the degree that we have, and meet the number of fabulous people who work tirelessly in all phases of dealing with pancreatic cancer from around the globe. It started with Mary Ann contacting some of the early founders of Lustgarten and PanCan, dealing with pancreatic cancer in a comprehensive approach through the Johns Hopkins Chat Room Board in December 2004, before my surgery. At the time, I think she was just looking for someone who could identify with what we were going through, to find someone who was maybe more than a 5-year survivor. They were scarce, needless to say. I think back in 2004, the 5-year survival rate was 5%. I believe that in 2014, it's 6%. So not much has been done in that. But we're trying, which we really, believe me, we really are trying. I finally was able to contact a wonderful man who had a complete pancreatectomy, like John was describing, and the friendship blossomed. We became very close over the phone as he was in Arizona, and when PanCan had their Evening with the Stars gala in Beverly Hills, he said he would go if I would make the trip. This was in December, so we could meet. My chemo and radiation were finished in September of 2005, and at the time I had no evidence of disease, so we robbed a cookie jar, bought a tuxedo, a fancy dress, and made the trip to Los Angeles to the gala. We met people mostly living with pancreatic cancer. As John said, there are only about 15%, I think that's accurate, that are eligible for a surgery unless some kind of chemotherapy is, and radiation involved to shrink the tumor. Caregivers, researchers, and Mary Ann and I were instantly attracted to the family atmosphere and spirit of hope, much like I found in the medical community that Dr. Allendorf, Stevens, and others involved created together, and how they cared for me. I found that I could make myself useful, first on a local level, sharing my experience by going to the infusion center, speaking to patients, volunteering in cancer wards, and getting involved in bringing pancreatic cancer patients to New York City when they were given little hope in the local medical community. We aligned ourselves where they were welcomed with open arms, and quite frankly. We aligned ourselves with the Pancreatic Cancer Action Network formally when I became part of the Survivor and Caregiver Network to provide hope and compassion for folks diagnosed with pancreatic cancer. Mary Ann was involved by that time in 2005 as a Team Hope coordinator in the Hudson Valley. My 3-month scans became 6-month scans, then a year. When a questionable lung nodule showed on one of the scans at year 3, Mary Ann let me buy my brand new Nitro desk boot. The following scan, the nodule disappeared, but I still have the boat. So, hey, listen. Along the way, I was found to be diabetic, diagnosed with coronary artery disease, neuropathy, Barrett's esophagus, in which I've had 2 halo ablations, suffered with congestive heart failure. And in 2008, a routine scan of my pelvis showed that I had inoperable prostate cancer, which, my being a 2-tour Vietnam veteran, was attributed to Agent Orange exposure, defoliant used in Southeast Asia. These other diagnoses were also connected to Agent Orange exposure, all but pancreatic cancer, which is not on the presumptive illness list for Agent Orange yet. We are working on that. With a prostate cancer diagnosis, we filed with the government, and I became a 100% disabled veteran almost 40 years after my service. So there's got to be a lot of irony there. Treatment of the cancer consisted of radiation and hormone therapy. As a team of doctors, including Dr. Allendorf, Stevens, and Dan Petrolak, said I was not a candidate for surgery. I had too much belly rearranging and radiation, and it would have made the surgery dangerous, as well as the potential to wake up the sleeping giant, pancreatic cancer. Believe me, the fact that I seem to be falling apart concerned me, but I also realized that I could still be useful and had more hope to share even in the light of the new diagnoses. I have to point out that due diligence in keeping all my doctor appointments and letting all the doctors involved in my treatment know what was going on was the utmost important, was of the utmost importance. So, and I definitely suggest that to all of you folks here who have been diagnosed with make sure that you keep all your appointments. It's very important. I have seen over the years folks that do not do the due diligence have had some not so great results as a result of that, and it's kind of unnecessary. A large part of our involvement was advocacy, like John was hoping that I would talk about. After the late Dr. Randy Pausch, Carnegie Mellon professor, testified on Capitol Hill in 2008, starting the movement of what was first the Pancreatic Cancer Research and Education Act, and ultimately passed as the Recalcitrant Cancer Research Act. Randy penned the last lecture. I don't know if any of you are familiar with it. The YouTube phenomenon that was the hypothetical, if this was the last lecture you were going to give to your students, what would you say? He got to do it for real, and he did it for his children. It's very compelling. It's also in book form if you can get that now. He brought out the urgency of dealing with the disease, the dire need for change, the dim statistics and mortality rate associated with pancreatic cancer, and the pathetic, and I want to stress, pathetic amount of federal funding directed toward pancreatic cancer research, and the fact that no real progress had been made in at least 40 years of treatment options and patient care. Not a pretty picture, but it's pretty accurate, actually. Up to the point that our bill got passed, and probably still today, most of the money and most of the grants and stuff come from the private sector. And for those of you who contribute to that, we are all eternally grateful. But now we're trying to hit up the federales. Just as an aside, that summer we were to have a meeting with our former Congressman Maurice Hinchey at home up in Middletown. And I was so sick from treatment from the prostate cancer, I didn't think I could make it. So my wife in her infinite wisdom, asked me the poignant question, you think Randy would have gone to the meeting? You think he would hold his side and buck it up and tell him what we need? So I got in the car and went to the meeting and asked the congressman for his support, and he signed on the bill as a member of the Appropriations Committee, very important stuff. And he worked magic behind the scenes in New York to get his colleagues on board. The miracle happened in 5 years. President Obama signed into law the Recalcitrant Cancer Research Act under the Department of Defense bill. We have become a force to be reckoned with. A unified voice, a sea of purple on Capitol Hill. Every year since 2008, we were making phone calls, sending emails, recruiting people to come with us in our passion to let our legislators know where we stood. New York is the center of research of this disease, we think, and we want to make sure that our doctors have what they need. And believe me, this doesn't stop all year round. Marianne has been the New York State leader for all the years we have been on the Hill, and I serve as a closer, locking arms with other survivors who come to share their experience, passionately telling our stories for all patients across New York and in the pancreatic cancer community all over the world. We've met some wonderful people, from folks in the entertainment industry, sports figures, doctors, researchers, scientists, people that run companies, survivors, caregivers, and folks that thought that this was a good thing that they needed to concentrate their efforts on, actions for pancreatic cancer reform. It has become electric, and it is still a memorable journey, believe me. So as historical and exciting this is, the passing of the bill, we still have a lot of work to do. A bill is only a bill unless the funding is there to get the smart people, the researching scientists, what they need to come up with a cure. This is where we are now, ensuring that the National Institute of Health and the National Cancer Institute in these troubled financial times receive what they need to remain effective in this battle. Obviously, we will not rest until this is accomplished. I have had the honor and good fortune and done numerous radio programs, like the hook up with that, and lots of PSAs, and was able to share my experience in the press. And one year, I was fortunate enough to be the national spokesperson for Advocacy Day. I was also honored to cut the first ribbon at the first Purple Stride in New York City when PanCan partnered with Presbyterian. I try never to miss an opportunity for the cause, and that's why I'm glad that Lustgarten is here today, and I'm glad that they have a walk. But I cornered Senator Schumer at the Lustgarten walk and point blank asked him in front of Dr. John Chabot, hey, since Mark Lustgarten was your friend, will you co-sponsor our bill for pancreatic cancer patients like myself before you go up there and give your speech? So he said, sure. Call my aide and tell him I said yes, which I did, and he did. Life is good. The truth is, I had plans. I wanted to retire in 10 years. This goes back to 2004. We lived on a lake, had a nice house, money in the bank, family was good. And in one day, life changed where nothing was the same. I'm sure those of you who are diagnosed with PC know exactly what I'm talking about. My best friend died, my lake drained, I couldn't use my boat, my medical bills sucked the bank accounts, and I had cancer. I wouldn't tell the truth to anyone about how absolutely sick I felt, and I know I minimized what I was going through in this speech. Those of you with this disease know exactly what I mean also. There were some bad days. My wife was scared, and she wasn't ready to let me go either. We were only married a year when I got sick, and after being together for 10 years, and there was no way she was going to let me pass away either. But you know what? Believe it or not, I took this as an opportunity to help others, not think about myself if I could. And what might have seemed to be insurmountable odds and mountains. It made it easier when I was with other people like myself, who had pancreatic cancer or other cancers, actually, laughing, working hard for one purpose, in spite of my disease. So 10 years later, I am very grateful to everyone who has been a part of my life and who has helped me by allowing me to help them. I thank you very much from the bottom of my heart. The disease actually has given me purpose, and this is part of the good that has come out of it. And to the end, purpose to the end. So I want to thank you for listening. I think I must have gone way over in time, but I want to thank you for letting me share with you, and I look forward to talking to you after we're done here today. So come meet Ace, Cheney Superdog, our therapy dog, and to Dr. Allendorf and his team. Thank you for having me here and allowing me the honor to speak today. I am very grateful, man. Thank you so much.